Knock, knock, knock.
Come in.
Perform hand hygiene and close the door to provide privacy. Hi, I'm Felicity. I'm going to be your student nurse for today. Can you tell me your name and your date of birth?
Teresa Delgado, 8/30/75.
Okay, so your name and your date of birth are matching with the wristband that you currently have on. Can you tell me what brought you in today?
I'm having difficulty breathing.
Difficulty breathing. Can you tell me the characteristics of your breathing? Like, how does it feel?
I just can't get a good deep breath. Like, I just feel like if I'm breathing, it just like shallow.
So it feels like breathing through a straw?
Mm-hmm.
Okay. When did this start? When was the onset?
Noticed it this morning when I was getting dressed for the day.
Okay. And is there a specific location on your chest that hurts more than others to breathe?
It's like right here.
Right there? Okay. And the duration, how long has it been occurring?
It's been since I woke up till now.
Okay.
All morning.
And the severity, how bad has your breathing been? Has it prevented you from accomplishing anything today?
No, I was still able to clean the house. I just like would take breaks
Mhm.
because it just really made me nervous because I didn't get better.
Okay. And then pattern, has it been constant throughout the day? Has it gotten worse? Has it gotten better?
It hasn't gotten worse, but it's been constant, and that's kind of why I was taking the breaks because I didn't want to make it worse because it wasn't kind of lightening up. So.
Okay, and associating factors did you notice it get triggered by anything, like by the smell of cigarette smoke or maybe a very strong perfume? No. Do you have a history of COPD or asthma?
No.
No. Have you had any recent illness with cold, flu, or COVID?
No.
No. Okay. And then have you tried to treat at home with anything?
No.
No? Okay, so using cold spa, you have told me that you're having a difficulty breathing. It started this morning. You didn't notice it was triggered by anything, but it kind of feels like you're breathing through a straw and it's lasted all day, but it hasn't prevented you from doing anything. You've just been mindful of your actions. Okay, so I'm going to go ahead and take your vital signs, that being your blood pressure, heart rate, respiration rate, temperature, and pain. Before I begin with your blood pressure, do you have a history of a mastectomy or a dialysis fistula in either arm?
No.
No? Okay. I'm going to go ahead and attach this blood pressure cuff to the cuff closer to me and uncross your legs for me. Thank you. Alright. Making sure I can see my little numbers. Okay. Okay. Your blood pressure is currently 120/80. I'm going to slide that off. I'm going to go ahead and check your temperature real quick. Alright, and it is currently 98.6. So on a scale of 0 to 10, 0 being absolutely no pain, 10 being the worst pain you've ever felt in your entire life, what would your pain scale be?
I'd probably give it a 3 for discomfort.
A 3 for discomfort. Okay. So I'm going to go ahead and count your respirations and your heart rate. In a real world setting, I would count for a full minute on both, but for the purposes of this video, I'm going to go ahead and count for 30 seconds and multiply by 2, okay? I don't need this. All right. Okay. Your heart rate is 64 and it's even and regular. And your respirations are about 20 and they appear to be even and regular as well. Okay, so based off of our current communication, you appear to be awake and alert. Can you tell me what day it is?
Sunday.
Can you tell me where you are?
The ER.
And can you tell me who the president is?
Trump.
Okay, so you are alert, awake, and oriented times 4. I'm gonna take my pen light and assess your pupils real quick. So just keep looking at my nose and I'm gonna scan this little light into either eye, okay? Okay. So your pupils are equal, round, and reactive to light and accommodation, and their size is about a 4, okay? Who brought you into the hospital today?
My grandson, Elijah.
Your grandson? So I'm assuming you have a support system at home? Yeah? Okay. And based off of the current communication we have, I'm going to go ahead and assume that English is your preferred method, language of communication. Okay. And based off of your mood and your mannerisms, you appear to be very pleasant, cooperative. You just appear to be a bit anxious. You don't appear to be angry or uncooperative in the slightest. So I'm going to go ahead and start with my skin assessment. Before we begin that, do you have any wounds that I cannot see at this moment?
Mm-mm.
Do you have any suspicious moles or lesions that I cannot see? Okay. If you did, then we would go ahead and note them and grade them based off of A, B, C, D, E, asymmetry, border, color, diameter, and evolution. But because you do not, we will have to skip that. Based off of my assessment, your skin color is normal for your ethnicity and race. I do note that you have several tattoos scattered across your skin. I'm going to take the back sides of my hand. I want to feel the temperature along your body, okay? Okay, so your skin is warm, dry, and intact. And I'm going to take my fingers and I'm going to kind of pinch the skin above your clavicle area real quick and check skin turgor. Okay, your skin is resilient, which just means it pops back up less than 2 seconds, indicating you are not dehydrated. Okay, so I'm going to go ahead and move to respiratory. I'm going to check both the front and the back of your thorax to check your breathing. Just breathe regularly for me, okay? I'm going to check with the diaphragm of my stethoscope. Okay. I'm going to move around to the front, and I'm going to check the front of your chest. Okay, can you lift this arm for me? I'm going to check Your side. Okay, and lift this arm for me. Okay. Your respirations are even and unlabored. No advantageous respiratory sounds noted upon auscultations, as well as no signs of distress noted. I don't see any outward signs of distress, no accessory muscle use, no nasal flaring, no cyanosis. I'm going to go ahead and move into the cardiovascular system. I'm going to listen with the bell and the diaphragm of my stethoscope. Also, again, normally we would listen over skin, but for the purpose of this video, we're going to listen over clothing. We're going to assess your aortic, pulmonic, Erb's point, your tricuspid, and your mitral valve. When I get to your mitral valve, I am going to ask you to lift up your chest, as the mitral valve, the mitral assessment point lies underneath the chest, okay? Alrighty. So starting with my diaphragm, I'm going to listen to my aortic. I'm going to move to my pulmonic. Erb's point. My tricuspid. And then would you mind lifting your chest for me? I'm going to listen at my mitral. Alright. And starting back over with the bell. And pulmonic. Erb's. Tricuspid. And lift your chest for me one more time. We're going to go to mitral. Okay. S1 and S2 heard. Your heart sounds even in rhythm and regular. No extra heart sounds noted. No murmurs, gallops, bruits noted. So I'm going to go ahead and check your peripheral pulses and your radial and your pedal pulses, okay? So can I see your wrist? Lay them flat like this. There we go. I'm going to check bilaterally. Alright, bilateral radial pulses are normal +2. And then can you uncross your legs for me? I'm going to check your pedal pulses. Okay, pedal pulses are normal and +2 bilaterally as well. While I'm down here, I'm going to go ahead and check the capillary refill of your lower extremities. All are less than 2 seconds. I'm going to as well check the edema of your shins, just using 2 fingers to press in to the shins. And I note no pitting or non-pitting edema. And then I'm going to go ahead and can I see your fingers? Check capillary refill on the upper extremities as well. And I note no capillary refill is less than 2 seconds, and no edema noted to upper extremities either. So the last thing for your cardiovascular is I'm going to check for jugular vein distension. So when I'm checking this, I'm going to take a pin light, kind of shine it over your neck real quick. When I do this, I will need you to kind of hold your breath for just a second for me, okay? So if you'll turn your head to the right for me, and hold your breath for just a second. Okay, turn it to the left and hold it for just a second. Okay. No jugular vein distension noted on either sides of the neck. So we're moving into our GI, which is gastrointestinal assessment. How are your bowel habits? Are you regular or are you irregular?
Regular.
Regular. Can you tell me the date of your last bowel movement?
Today.
Today? Okay, so do you have any problems with diarrhea or constipation? No. Do you have any issues with incontinence of the bowel? No. Do you have any issues with or have you noticed any blood in your stool when you have a bowel movement? No. Okay. Do you have any issues with nausea or vomiting when you eat or after you eat? And do you have any problems with swallowing or chewing foods?
No.
No. Okay. Would you mind laying back on the bed for me? Okay. I'm gonna inspect the contour of the patient's abdomen from the side of the bed, noting that it is rounded. And then if I go to the foot of the bed, I can check symmetry and note that it is symmetrically rounded for the abdomen. And, excuse me, I'm going to auscultate before I palpate your abdomen, okay? In real clinical settings, we would listen in each of the 4 quadrants for 1 minute. And if we had not heard anything, we would listen up to 5 minutes. But for the purposes of this assessment video, I'm going to listen for 15 seconds, okay? So starting in your right lower, I'm going to listen with my diaphragm. Okay. Okay. Bowel sounds are normal active in all 4 quadrants. You can go ahead and sit up for me. I do have to palpate you real quick before you sit up.
Okay.
And as well as move my blood pressure cuff before I end up dying. Okay, so I'm going to take one hand and we're going to start with light palpation. Just let me know if you have any tenderness, okay? And wherever I touch. Any tenderness so far? No? Okay, I'm going to take 2 hands and we're going to go a bit harder and deeper, okay? Tell me if you have any pain, okay? No? Okay. No? Alright, you can go ahead and sit up. Okay, so we're going to go ahead and move into our GU, which is our genitourinary tract assessment. Can you tell me your voiding pattern? How do you pee? Are you regular or are you irregular?
What's voiding pattern?
Your voiding pattern is how do you pee? Do you pee every day? Do you pee every 4 hours?
Oh.
Are you regular or like do you?
I mean, I'm regular.
Regular? Okay. Do you have any problems with incontinence of your bladder? No? Do you have any problems with frequency, as in you pee very often?
I pee pretty often, yeah.
Okay. And do you have any issues with retention, as in when you go to pee, you don't void out everything that was in your bladder? You hold on to some?
Mm-mm.
No? Okay. Do you have any issues with burning or itching or anything like that?
Mm-mm.
Okay. Have you noticed any blood in your urine?
Mm-mm.
No? Okay. Alright, so can you describe the color of your urine? Was it like a straw colored? Was it really, really pale? Was it dark?
I mean, it's not super pale. I mean, so I guess a little darker than that.
A little dark? Okay. Does it have an odor to it?
Yes.
Yeah. Is it cloudy?
Mm-mm.
No? Okay. And then the last assessment for our head to toe today is your musculoskeletal. So, in your upper or your lower extremities, do you have any numbness or tingling?
And these two fingers tingle.
Those two fingers tingle? Okay. But that's the only place that tingles? Is it just those fingers, or does it move up your arm?
It's just the fingers because, like, I have a pinched nerve when I sleep.
Oh, you have a pinched nerve? Okay. So I'm gonna go ahead and I don't note in the room with us a cane or a walker, so I'm assuming you don't have an assistive ambulation device?
Mm-mm.
No? Okay, so you walk pretty well on your own. Okay. I'm gonna note, I'm gonna test your range of motion in your upper and lower extremities, as well as simultaneously checking your strength in both upper and lower. I'm going to check 2 points of both, okay? So if you'll curl your arms up like you're lifting a weight for me. All right, push against my arms, okay? Pull against them, okay? And hold your arms out like a T. All right, push against, okay? And pull against, okay? Upper extremities have full range of motion, as well as 5 out of 5 strength. Okay, can you uncross your legs for me? All right, with my hands on your shins, can you push? Okay, and then can you pull? Okay, and with my hands on your toes, can you pull towards you? Okay, and then can you push your feet towards? There we go. All right, so your lower extremities have full range of motion, as well as having 5 out of 5 strength. So that concludes our head to toe assessment today. Thank you for being cooperative with me, and the healthcare provider will be in shortly to continue his assessment.
Do you not have to do my little toes?